Hi, everyone. I just wanted to first say thank you for tuning in to this talk. This is the third in my series on pain management, self-care for injuries. And really my goal with this is try to give you some tricks that you can do for either you or your family at home to try to help you with different situations you might come up with. So you can reduce your likelihood of needing to go see different doctors and that kind of thing. So today I'm actually going to focus on Hypericum. So Hypericum is actually a plant you probably already know. It's also better known as St. John's wort. What's interesting is different traditions have different uses for sometimes the same plant. And so many of you are probably more familiar with St. John wort's modern herbal usage, which is using St. John's wort for depression. But it also, in homeopathy, we don't use it for depression. In homeopathy, you use St. John's wort, the homeopathic version, for pain and pain management. In particular, you use it for nerve pain. And so any circumstance where you have like a sharp, intense nerve pain, um, and that could be stuff like maybe you slammed your finger in the car door or you hit your finger with a hammer. That could be like you slipped and fell and hit your tailbone. That's the bone that's at the very bottom of your spine, kind of near your rear end. Could be like maybe you just turned wrong and suddenly got really sharp, intense pain in your back. Sometimes you also use it for puncture wounds, but that's more like if you happen to get a puncture wound and again you get that more sharp, intense pain. Another example could be like a dental extraction. And so so far I've given you two remedies potentially for dental extractions, or for dental stuff. One is if you have a dental cleaning and you feel achy, sometimes that would be arnica. But if they're removing a tooth and you get like a more sharp, intense pain because there's a big nerve bundle right in the middle of the tooth, then that would be hypericum. And with hypericum, more what you're thinking about is not just what happened. We want to think about like, what am I experiencing? And so the experience is kind of more that, like I said, there's an injury that happened, but then there's like sort of this intense electric nerve-like pain. And so, and that nerve pain might stay local, but sometimes a sign of nerve pain is also if the pain is suddenly shooting up or down your arm or other body part. That's probably a good indication that a nerve is involved. So for example, if you turn just funny and also get back pain, and now the pain also isn't just in your back, but goes down your foot, or all the way down to your foot, that's probably a sign that you injured a nerve. And so hypericum is one of those nerve injury remedies. It's easy to use. And again, I covered some of this already in the arnica video, so would refer you back to that video if you want greater detail. But you can just use an oral pill. And homeopathic remedies come at different strengths, and so how often you do it will depend a little bit on the strength. But usually do it between 1 to 4 times a day. And pay a lot of attention to how it's treating you in terms of like if you're noticing like if you're doing it like say twice a day and you're not noticing improvement, but you feel pretty good, hypericum is the right remedy. Then it might be you're just not doing it often enough, and so you can increase the frequency, how many times a day you're taking it, to see if you get more of effect. And also, once you sort of feel like you're out of pain, you don't need to keep taking it. So the point of a homeopathic remedy is to help you get rid of the pain, and once you're out of pain, you stop until the pain returns. And one of the beauties of homeopathic remedies is that you can also pair this with any medication, supplement, herb. Homeopathic remedies are also very safe for children. It's very hard to hurt. It's generally very hard to hurt yourself with a homeopathic remedy, which is one of the reasons why I started that for this talk. And also, if for a reason, if the homeopathic remedy starts to create a new symptom, which is pretty rare, but like with anything, if it creates a new symptom, they should stop it. And within a day or 3, you should notice that the symptom disappears. That's a pretty good indicator that's the homeopathic remedy that did it. If the symptom doesn't disappear, then it probably has nothing to do with the homeopathic remedy. And again, if you have any questions about any of this stuff, you're always welcome to give my office a call because we're here to help you with pain. I probably spend a lot more time working more with chronic pain. This is more of an acute pain series. But again, if you should have any chronic pain issues that you feel like you need more help with, that's one of the things we're here for. And I just want to say thank you for tuning into this talk series. And again, don't forget to tune in to watch some of our other homeopathic remedies series so you can get a chance to kind of get the full breadth of the different tools you have available to you. Anyway, thank you again for tuning in.